Good morning. How are you?
I'm good. How are you? My name is Brianna. What's your name?
I'm Dr. Harris, and this is your patient.
Hello, hello. Um, I'm gonna ask you a couple questions. Is that okay?
Yeah, you can go ahead.
Okay, so I would like to know what her age is.
Okay. How old is she?
She's 9 months.
It's 9 months old.
Okay, and what brings her in today?
Okay. What's wrong with
Okay, she's her body is good. Her body temperature is high.
Okay, and what again?
And she's having cough.
Okay. Okay. Came in today with cough and fever.
Fever.
Any news?
Is the fever coming and going, or is it consistent?
No, it usually comes and goes.
Yes.
Okay.
Especially in the nights.
Okay. Is she coughing?
Yeah, she's coughing. Yeah, she's coughing.
Does she release any mucus when she coughs?
No, bro, her nose is running. She has a runny nose.
Okay, okay. And has she been tired recently?
Not really.
Okay. So, has the child experienced any diarrhea, vomiting, or nausea?
Any diarrhea?
Yes.
Okay.
But not upset.
Okay. There is diarrhea, but not really that much.
Okay, okay. And you said she's experiencing a runny nose?
Yes.
Okay. I I would like to run a rapid diagnostic test, and I would like to do a throat swab as well.
Yeah, okay. We'll do that. Okay, we'll do that for you. So what are you thinking?
I'm thinking the child has malaria and an upper ARI because of the runny nose as well as the fever that comes and goes.
Yes, yes, yes. So the rapid diagnostic test for malaria is positive. It's positive for malaria.
Okay.
So how are you going to treat the patient?
I would give the patient an ACT and I would give them antipyretics for the fever and I would ensure they get as much fluids as possible.
That's very good. That's very good. Okay. So is that all you will do for the patient?
I would ensure that they do get as much rest because they have a upper ARI.
Yes.
And because it's an upper ARI, we can't give them any antibiotics.
Yes, yes. That's wonderful. That's very correct. That's very correct. Okay, so any preventive measures?
I
Any
would,
preventive measures? Yeah, I'm listening.
yes, I would recommend the patient ensure they're doing proper hand washing and also keeping them away from anyone who is also coughing. And if possible, I would recommend they get vaccines to ensure that common diseases like this don't happen again.
Okay. So what about for the malaria? What would you do for them in terms of prevention?
I would stay away from still bodies of water because mosquitoes tend to breed there. I would also, mm,
You are doing very well.
thank you, thank you. Um,
Maybe you advise them to use insecticide treated nets, bed nets.
that's bed nets, repellent, and I
Yes,
also advise them to cover up more so the mosquitoes can't bite them.
that's very good. Wow, we are starting very well today.
Thank you.
So let me give you my feedback. I am really impressed with your attempts. You are very composed, you know, and you demonstrate knowledge. You ask the necessary questions, and you've utilized the answers given to you to make an accurate diagnosis. And the way you treated the patient seems like as if you are a practicing medical practitioner. So you are a medical doctor because you tackle you give appropriate treatment for the malaria, Then you've also recognized that for acute respiratory tract infection, you don't just give antibiotics, isn't it? You don't just give antibiotics. So it was really nice of you to remember that. And then you've given your patient some recommendation on ways to prevent herself from coming down with this disease. That's a very commendable attempt. You keep it up, please.
Thank you so much. I
You're
hope you have
welcome.
a wonderful rest of your day, and I hope the baby feels much better.
No, thanks.